Well, good afternoon, everyone. How is ya? How you doing? And we're going to continue with question and answer Tuesday. That ought to throw you off. So say hello and let's get going here. We got Nativity, good afternoon. And Bernice, Mike from Norland, Annette, and Carol, or Carol, Mary, and Corrine, and Darlene, and Danny, good afternoon. Wendy, how are you? Marco, Linda, Nellie, welcome. Francis from Vaughan, Diane, and Kevin, and Jane, Neelam, and Nick from our staff. Good afternoon, Nick. Maduri, and Debbie. Sorry, how are you? Rachel, good to have you guys on. Andrea, hello. And Marie Rose. My wife is Rose Marie and you're Marie Rose. Chantal from Ottawa. Rita, hello. Maureen, Georgie, Halifax. And Diane, Thunder Bay. Blanche, or Blanche, Newfoundland. Margaret, Dan, and Gail. Okay, a couple of more guys and we'll get going. Carolyn, how are you? And Julie, and Lise, how are you guys? Always fun to have you on. Deb, how are you? Mike, Nancy, and Wendy, another Wendy, with her afternoon bone broth. Good idea. Kathy, David, we love you. Faye, and Janice from Brampton, and Lisa. Guys, thanks again. Thanks again, Connie. Connie from Quebec. Judah, Brantford. Okay, Ida, Jenny. Once again, guys. Sandra, all the way from beautiful BC. Yeah, so beautiful. Leon. Let me see where Leon is from there. He just gave me some Labrador, all the way from, what did you say there? Leon from Lance-au-Loup, Labrador, Canada. Well, holy moly, I can't say that I've ever heard of that. Susan, Terry, Laurie, Denise, Stacy, Lise, Lisa Marie, Joanne, Susan, June. Okay, I hate to miss anyone. Dell, and one more, Catherine from Parksville, British Columbia. Here we go. Okay, here we go. We're going to finish out as much as we can. I think we can get it done today. The questions that were asked, and I got to some of them yesterday. Charlene, do we get iodine from eggs, meat, and cheese? Yup. You do. Yeah, you get iodine. Now, you're not going to get a boatload of it, but I got to tell you this, okay? And thanks for the question, Charlene, but I got to tell you this. One of my pet peeves is the misinformation that's out there, okay? And we're going to get to another one specifically. There's a couple of questions that are just misinformation, okay? Now, when it comes to your thyroid, because whenever you think thyroid, you ought to think iodine, because one thing for sure, your thyroid's not going to work without iodine, okay? It's just not. And it's not going to work without selenium. And really though, your thyroid needs a lot of nutrients to work properly. This is why I tell people what is such fake news is when people talk about they get all their nutrition in the plant kingdom. Now, I know, I say it maybe too often. Guys, listen, plants are good, okay? Plants are good. Fruits and vegetables are good. But they're not the best. When it comes to, we use a word, when it comes to absorption, we use a word called bioavailability, meaning that, it's not really, we used to say you are what you eat, but really you are what you absorb. If you can eat the best diet in the world, if you don't have a good digestive tract, you're not getting all the nutrients that you need. You're just not breaking them down. So it's called bioavailability, okay? Now, when it comes to the animal kingdom, eggs, meat, and cheese are 1,000 times, in terms of nutrients, much more bioavailable. Now, I talked a little bit about this in the book, The Reset, okay? Why, like vegetables, for example, and plants, they have a lot of what they call protective things around them so that animals won't eat them. Like when you look at what oxalates are and phytic acid, these are things that prevent certain animals from even eating plants because they can't digest them. And look, I'm again, plants are good, fruits and vegetables are good, but when it comes to phytonutrients, the animal kingdom wins hands down. Here's what I'm saying. If you want a good thyroid, and I think one of the reasons, not all of the reasons for sure, but some of the reasons that women have so much trouble with their thyroid is because 50 years ago, they bought into the lie of animal product, eat low fat. And eating low fat means you're staying away generally from eggs, meat, and cheese. If they are having, they might have a little bit of chicken in their salad, but they're not eating nutrient-dense foods. Your thyroid needs nutrition. It needs iodine, it needs selenium, it needs your B vitamins, it does. It needs B12 even to function properly. Your thyroid doesn't function properly. It's so finicky. The thyroid is a finicky organ on the best of days. And so, yeah, if you want to add some iodine, salt, go ahead. But you get it from the most bioavailable iodine, and selenium comes out of the animal kingdom. Okay? Good question, Charlene. I'm glad you asked the question. Don't be shy asking questions about that. I want you to ask questions. That's how you're going to learn. Okay? Now, Claudia, any suggestions for adenoids for children? Well, again, look, eliminate, Claudia, like adenoids don't just, I don't believe they just show up like that. I believe a child that's got trouble, recurring adenoids, recurring tonsillitis, and this kind of thing, they have an underlying condition. They're usually low in vitamin D. They don't have enough levels of vitamin D. They don't have enough levels of vitamin A. They probably have a malabsorption syndrome to some extent, partially leaky gut or undigested food. These are the kind of things that you really got to look at. Look at the gut and look at the immune system with the vitamin D and the vitamin A, because a vast majority of children are very, very low in vitamin D and vitamin A. And the reason is they don't eat enough animal kingdom food. They don't. They live on cereal, sugars, crappy carbs, vegetable oils, and they just don't get, they're overfed. Kids are overfed and undernourished. Like the idea of, you're getting some cheese on a pizza. You know what I'm saying? Like it's just not the best nutrition, and crappy dinner and the rest of them, right? Like it's just not the best foods. And I think a lot of the reasons that you see so much with adenoids and even tonsillitis recurring, they don't get enough. The invisible mask is the vitamin A. And vitamin A is when you eat red meat. You get some in eggs, you get some vitamin A in cheese, but you get a lot more vitamin A in butter, and you get a lot more vitamin A and vitamin S, and that is steak. Okay? Ashley, can Dr. Martin discuss hyperglycemia? Specifically to when you cut out sugar and carbs and are having a hard time. I'm not quite sure, Ashley, what you mean, okay? And you might send in another email to me and clarify that, okay? Because hyperglycemia is, high glucose. But high glucose is never what I look at so much. I'm more interested not so much at your glucose, although I will. If you look at it, A1C, I find that to be a good measurement. Look, it's a measurement of glucose, but it's a far better measurement of insulin. And all I'm saying to you, Ashley, okay, and maybe you have trouble getting your blood sugar down or whatever, focus. Maybe just you, okay, just the way you're built. Focus on protein. Protein is the king. Live in the animal kingdom. And it sounds like you're doing that. It seems to be. But you might have to be, Ashley, like, you see this face here? Okay? I gotta be disciplined all the time. Why? Because I have a tendency, it's my genetics or whatever, I easily gain weight, 1. 2, easily get insulin resistance, easily. I had diabetes coming out both ears in my family. My dad and my grandfather, and I have a sister, diabetes. And, when I look at myself in the mirror, I try and tell myself, will you not be deceived? Don't fool yourself. Don't make excuses, whatever. Look, I need to be disciplined all the time. If you know me, you hung around me at all, I live on discipline. I have to. Some people, they say they get, I'm not sure if they actually get away with it. Eventually it catches up to them. But I have to be disciplined because me and carbs, we don't get along. And I found that out years and years and years ago, and I married an Italian, for heaven's sakes. But I can't live on carbs. I can't. I don't do well. So Ashley, I'm trying to read between the lines here with you that you're struggling, and it's I don't know if it's because you're measuring your sugars or whatever, and you might be up in the higher end. Well, all I can say to you, Ashley, is you're a canary in the coal mine. You got to be triple disciplined. And you know what? At the end of the day, being disciplined is very, very good for you. You know it is. Yeah, I tell young people all the time. You know, I'm a preacher, by the way. I do a lot of youth conferences. Well, I used to. I'm getting too old. They don't want me anymore. But I used to tell them all the time, you can't succeed in anything in life without discipline. I said, you know, if I was to give you 1 point, you got to learn to be disciplined. Okay? You got to learn to be disciplined. At your job, at your marriage, with food, raising kids, whatever, family, discipline. You need it. And actually, again, I might have misinterpreted your question, but there's no shortcuts, no easy answers. Understand who you are. D.L. Moody, a famous preacher, you know, well over 100 years ago said this, and I liked it. He said, you know the person I have the most trouble with in the world? Me. And that's me too, okay? And so I gotta, hey, be disciplined. Good question. Okay. Nancy, I have completed a few resets, good for you, and eat clean, drink lots of fluids. What does that mean? You drink a lot of water, you mean, I hope, okay? Sometimes I have painful dry lips. Any ideas? Do not work outside. Well, you could, there's a couple of things that I think of. Whenever I think of lips, mouth, that area, here's what first thing I always look for, always, okay? Would be B12, okay? Mouth, B12, okay? Numbness, you know, like a perverted feeling in the mouth to some extent, swollen tongue. I always looked at B12 because I measured it. So I was always looking for it. And it was amazing that was probably the thing that I saw the most. Now, the dry lips could be your thyroid being sluggish. Amazing vitamin D, you know. Sometimes we'll give you some weird, if it's low, okay, it's back. Now, I don't know what happened, guys, okay? I don't know what happened. It might have been Facebook. It might have been my Wi-Fi. I don't know. And I don't want to touch anything. It said, if you want to finish, I could have touched my screen. It probably would never come back. So, anyway, is everything all right? Somebody give me, anyone else experiencing the frozen video? Is it coming in and out? I haven't seen it, only the once. Okay? And look, I'm getting some funny faces and the thumbs up. Okay, here we go. Okay, here we go. Now, Esther is asking, does breaking a vitamin D capsule, putting it on your face, have any benefits? Well, look, I never really think so much. Look, I'm a Viderma guy, Esther, okay? I'm a Viderma guy. Sun on the skin. Now, a vitamin D capsule, you know, the oil, you know, we have an oil in with a dropper. I probably would be good, a good benefit to your skin. I gotta try it. I don't know. I'm not quite sure. I know Viderma is really good for the skin, okay? Meaning sun. Now, don't burn, but, and can I just give you an idea, something that I know, it's more anecdotal a bit, but let me just say this. If when you get off sugars, and you get off crappy carbs with those crappy omega-6 oils, vegetable, they call them vegetable oils, they're industrialized oils. When you get off of that, amazing how you can get into the sun compared to what you used to. Now, I heard that over the years from hundreds and hundreds of patients. They can get more sun because they change their diet. It always works inside out, guys. They change their diet and they can get more sun. Now, don't go burn in the sun. No, I never suggest that. Okay? Good question, Esther. I'm going to tell you what. I'll do a little testing for you. Now, the best skin product, in my opinion, topical, is our Rivera. Okay? That's my formula there. Okay. Now, Betty is saying, or Elke is asking about the best source of iodine. So I talked about that too, Elke. I didn't see your question, so I think I did answer that. Betty, can you talk about crystal deodorant? Yeah, crystal deodorant is mineral, right? And they put it into like a rock almost, and then you can use it as an underarm deodorant. Now, here's what I say about that, and I missed a question up there, but I'll come back to that in a minute. Betty, here's what I'll say about that. Look, if it works for you, good for you. There's just some people have told me, Doc, unless I use, look, I would rather you much be natural. Be natural as you can. Stay away from any aluminum or whatever, because when you put it underneath your armpits, remember where your lymphatics are, okay? They're there. And, if the crystal deodorant works for you, there are a lot of natural deodorants that are out there now compared to, go back 20 years ago or whatever. I mean, there's some ones that I find pretty good. So I think it's up to the individual in terms of, whether it's really effective or not. And, okay. So I missed one here, and this is what it was. Catherine, sorry, Catherine. A friend was told her cavities and infection in the mouth are caused by saliva having too much acidity. I'm getting a headache. I'm getting a headache. Even before I finished the question, Catherine. By having saliva that is too acidic from eating too much meat, dairy, and not enough carbs. Now I'm into a full-blown migraine. Can you see it on me? Well, I don't know who said that to your friend. I don't think it would have been a dentist. There. Guys, I don't know what happens. I'm going to check my signal afterwards. See what a headache does? Sorry, guys. Sorry. Won't sound like that on the podcast, though. They'll clean that up. But let me just say this, okay? Every dentist, first day in dental school, you know what they learn? About cavities. You know what they learn about cavities? First day in dental school. Sugar. Sugar causes cavities. Okay? Sugar causes cavities. Everybody knows that. Mothers know. Ask mothers. Sugar causes cavities. Sugar is acidic, honey. Now, Catherine, I'm not picking on you. Okay? I'm teasing. But let me say this. Ooh! Meat is not acidic. Dairy is not acidic. Now, imagine, I can't get over it. That is fake news. You eat red meat, your body releases bile, your body releases sodium bicarbonate to make it alkaline. Because you could never eat a tomato. Everybody knows that lemons are acidic, tomatoes are acidic, but when they get into your body, they're not acidic anymore. Okay, they're not. But what causes cavity is something that is acidic, sugar. And when you eat it, it don't ever turn, because you don't release sodium bicarbonate when you eat sugar. It's going to stay acidic. It's going to change your pH. Anyway, my headache just went away. Although this interruptions today in our feed is really driving me crazy. Okay. Michelle, my belle. Hey, can a sluggish thyroid be cured? Yep. Well, yeah. Absolutely. Okay? We had thousands of patients over the years that had trouble with their thyroid and they fixed it. Now, as you well know, the thyroid's complicated. It's never easy, especially when you're a female, because females got hormones. And if you got hormones, there's a lot of things that play with that thyroid. And we talked about it the other day, a sluggish thyroid. Okay? And, but it can, you start with the diet. Start with the reset. The reset is meant to fix your hormones. Okay? And you're not going to be able to fix your thyroid unless you fix up your diet. You got to fix the diet. The reset is a 30-day program to help you to do that. And the thyroid distress syndrome, or sluggish thyroid, has a lot of complicating factors, but doesn't matter. Yes, we've seen people go from, if you've ever taken our courses online and look at what is a category 5 storm. I mean, hormones from the thyroid to the adrenals to the ovaries to you name it are out of wacko. All of it. But we've seen these people get better. Now, it doesn't happen overnight. If they're really, really out of whack, they got to stick to the process. Okay? Good questions. I love these questions. I really do. Okay, and can Dr. Martin talk about a fallen bladder? Yep. Can I say something? I'm going to say it. It's my program. Noeline. Why do we? I'm gonna do this. I'm folding my arms. I'm going to ask a question. Noeline. Why do women have trouble with their bladder and not men? Not that men don't have a bladder. You know we do. Why do women have trouble with bladder and falling bladder? You know, men, when they get bladder problems, they get bladder cancer. Okay? They don't get fallen bladders. Okay? We're from another planet, if you didn't know. So we don't get fallen bladders. We get swollen prostates. We have a lot of trouble with that. But why? So when you ask the question why, it's women. Okay. Well, it's hormones. Okay. What hormones do women have that men don't have? Estrogen. Yeah. Well, men can have a lot of estrogen, but they shouldn't. Women have estrogen and what? Progesterone. And your bladder will do really well when you have enough progesterone and enough estrogen. Not too much estrogen, but enough progesterone and enough estrogen. Because your bladder, ladies, needs progesterone. Men need progesterone too. Did you know that? A little bit. Progestation. We're never going to have a baby. If we ever had a baby, we'd only have one. We would never have another one. Men are big babies themselves. They don't need to have babies because they're big babies. True or false? True. They are. Men are likely to drive us into World War III. Oh, anyway. Good question, Noeline, but you need balance there, okay? You need balance there. And Marcel, can Dr. Martin explain pseudogout versus gout? Well, pseudogout probably mimics it, get all the symptoms of swollen joints or whatever, and without high levels of uric acid. And you know what? That is a lot more common, Marcel, than people think. It's something that I used to see in the office so often, it was incredible. A pseudogout. But I used to tell people effectively, if it walks like a duck and talks like a duck, it's a duck. You got gout. My doctor said, nah. Yeah, I don't care what your doctor says. You got all the symptoms. So lay off the sugar. Lay off the carbohydrates. Make sure your kidneys are functioning properly. Drink a lot of water. Drink coffee. Coffee helps to lower uric acid. Did you know that? It does. Okay? It does. Coffee helps to lower uric acid. Imagine an acidic drink like coffee. Acidic. Lowering acidity. Hello? How can that be? Because your body is fearfully and wonderfully made. You were made to drink coffee. How many years have I been telling you that? Don't you ever listen to someone that tells you not to drink coffee. Don't listen. It ain't true. It's fake news. You drink water and coffee, and you'll be healthy. There you go. Okay. I was off a little tangent there. How do I treat costochondritis? Costochondritis is very, very painful between the sternum and the, you get a little, where the joint, the rib attaches into the sternum, like you touch your breastbone right here, and you ever had someone with costochondritis, very, very inflamed and painful and can be very debilitating. And the best, get on our inflammation formula. I found that to be effective. It takes about 2 or 3 weeks of a fairly good dose, 4 to 8 capsules a day of inflammation formula. That, anything better than that out there for that, I've never seen it, and I mean it. And, but you know what I would personally do? I used to tell patients that, take out a little bit of cream, you're sitting there watching TV, and get at the sore spot. Get at it. Like, get in with your hands and work it. Get right. It'll hurt. But if you don't break down that little fibrous tissue that's developed there, you won't get rid of it. And most doctors, they'll give you drugs or whatever, and a lot of times, it's just a Band-Aid. It's not fixing the actual problem. Okay. Let me see here. Did I answer that? Yep. Patricia, adding a water softener to a full house water system, filtration system, is it a healthy choice? Well, look, you better filtrate your water anyways. Like, if adding a water softener, I gotta think about that. I mean, it's not an unhealthy choice, I don't think. It's not so much that. Like, you never want to drink unfiltered water. You make sure that you filter your water. Now, you might not get rid of everything in the water, but you filter the water. Let me look into that, Patricia. I'm not quite sure, like, as far as a healthy choice. Maybe healthier for your appliances, but not you. I mean, the reason that water is hard is because it's mineralized, right? And that can be hard on your washer and dryer and your dishwasher and your your coffee pot or whatever. But you need minerals in water in order for its pH to be good. Okay. Does coffee, oh, by the way, Kathy, you asked the second question. Does coffee affect costochondritis? Well, in a good way. Even if you have pain, isn't it good to have a coffee? Coffee is very anti-inflammatory. Yeah. Okay. Marlene, what is Cushing's disease? Well, that's when Cushing's disease is a disease of your adrenal glands, adrenal, on top of your kidneys. And people that get Cushing's are people that have high levels of cortisol for a long time. You know when people usually get Cushing's? Is when they are on steroids, like prednisone, for a long period of time. They get the moon face, and they gain weight like nobody's business, and their adrenals aren't working properly. Cushing's, okay? And there's Addison's, there's Cushing's. These are adrenal diseases. But most people don't have Cushing's or Addison's. What they do have, though, is high levels of cortisol really can mess you up without Cushing's, okay? And that can create major anxiety. Okay, couple of more, we're done. Linda, what would make my eyes go bloodshot all of a sudden? Usually dry eyes. You might have an infection. That can happen like overnight. You can get an infection in your eyes, making them completely bloodshot. Dry eyes can do it too. Dry eyes usually, though, what the first is your watering eyes. Your eyes overcompensate with so much tears. Okay, but look for that. Could be viral or bacterial. Jeanette, okay. Dr. Martin, what did they think about the unknown neurological disease, which is a cluster of 48 patients? Well, look, it's not the first time that they've found. Like, I remember, look, I've been around long enough, okay? If you just, like, if I give you a little bit of background about Lyme's disease. Now, you guys have heard, I think you have, of Lyme's, right? Well, Lyme's, you should have seen the stuff 20 years ago. Lyme's disease. There's no Lyme's disease. And if somebody gets it, it's one out of a gazillion. Well, then they found out there was pockets, like they found in New Brunswick with neurological. They found in Pennsylvania and different places. Holy moly, there was like a real outbreak of Lyme's disease. And, ticks with deers and things like that were bringing Lyme. So all I'm saying, okay, neurological, there's probably a tick or there's probably a bug that hit those certain people. They were the canaries in the coal mine. Their systems were fragile for whatever reason, and it was in a geographical area, and it can happen. Okay. Jeanette, thanks for the question. Okay, guys. Now, we love you guys. Sorry for some of the technical difficulties today. Don't ask me why. I have no idea. Okay? But we're going to see you soon. And if you have any questions, keep sending them in. Don't be shy to ask questions. We love you guys. Talk to you soon.